Okay, so I'm going to be talking about what's trending in lazy eye management. So we do know that the striate cortex is the main area where we have the ocular dominance columns, the V1 and the V2. So what I would like to actually talk here is the basic plasticity mechanisms. So now there are two plasticity mechanisms. One is the excitation inhibition at the molecular level, and the second are the actual structural changes. So there are two things that we have to look at when we look at neuroplasticity. First is to remove these structural breaks that are actually impeding the plasticity to happen. One of them is the perineural nets, which actually are physical nets that surround the dendrites, and the second is the myelin, which actually acts like a structural break, preventing the axonal transport. Now these two factors are the structural ones, whereas there is something called excitation inhibition balance. Now this is something that we are working on. All the enrichment programs that we see, the dichoptic therapy, the perceptual learning, all of this works on EI balance. So what is the excitatory? We need more of excitation, which is done by the GABA, which is done by dopamine, norepinephrine, acetylcholine, serotonin. So this is the next one, which is about environment enrichment, which is what we are doing right now. So environment enrichment is basically all the video games that we talk about, the physical exercise, perceptual learning, and the recently trending dichoptic therapy. Now there is a difference between perceptual learning and dichoptic therapy. Perceptual learning actively inhibits the dominant eye, whereas dichoptic therapy reduces the contrast. So this is the perceptual learning is a push-pull training. One side pushes, the other side pulls. Whereas in dichoptic therapy, there is actual reducing of contrast. So what you're doing is competitive inhibition in dichoptic therapy. I'm sorry, it's not coming on. Yeah. So basically there are interocular suppression mechanisms that are there. So when you have a dominant eye closed, the amblyopic eye sees. But when you remove the dominant eye, the interocular suppression pathways get excited and the amblyopic eye doesn't see. So this is how dichoptic therapy works. So when you give parallel stimulation with dominant eye lesser stimulation, then what happens? These interocular suppression pathways in dichoptic therapy get blunted. Thereby the therapy works and the amblyopic eye tends to see together in a real life scenario. The important thing with dichoptic therapy is there should be no strabismus, no microstrabismus, and no eccentric fixation. These are the three no's for dichoptic therapy. You cannot give them in this. So this is how the therapy works. I'm just going to skip through. So these are the ones that are available right now. The Binox, Visuoprime, which is from Neurapi, we have QC, and we have Amblyopia. All of them work primarily on the principle of dichoptic therapy. So I would like to share Dr. Soumya's slide on they had an interesting study where they studied Binox as such, and they found a good recovery with that. This is how the Binox interface works, and it's basically one eye sees one and the other. So they are based on red-blue anaglyphic red-blue glasses. This is the CureC, which is another software. This is from Dr. Aditya, and he uses it, and he's had good success with it. So again, here you see they have this is the dashboard of how it looks, and they have several games which are quite interesting. And you can actually monitor them real time. Okay, so this is the future. The future are AI based therapies. We are looking at eye tracker based therapies, which is the trending thing probably in the future. We have oral neuromodulators like levodopa and citicoline, which I talked about, the EI balance, and red light therapy as in the future, and dark exposure. Actually, dark exposure kind of creates a reset in the cortical level. So this is the other thing that's come out. This is the one I was talking about, the eye tracker system, which is the NeuraSim. So yeah, that's about it. Thank you.